Take your time, okay, if you need a rest.
As Anthony George sweats through his rehab sessions, he dreams about the things he did before he got COVID-19, like his art. And
if I can get back on a bike someday, I'd be the happiest man in the world.
George was admitted to the ICU last June with shortness of breath. He spent 70 days on a ventilator being fed through a tube. One of his doctors, Richard Chang, says he was resuscitated several times.
He also experienced a lot of ups and downs in the ICU, and a lot of infections, actually. He had a rough go. He had a very rough go.
After getting out of the ICU, George spent another 2 months on the medicine and rehab units. He's still on oxygen.
I think when people hear that someone's out of ICU, they think, oh, good, they're good.
That's the beginning of the journey.
That's the beginning of the journey.
Yeah.
Like if you were in your kitchen at home.
Yeah, that's what I really need help with.
Right, and trying to...
George has been coming to this outpatient rehab clinic twice a week since October. Occupational therapist Andrea Duff is helping him to do things like open a peanut butter jar and tie a shoe.
So we're trying to get some of those day-to-day activities that he's struggling to do. We're trying to work on some of those things so that he can gain some more independence.
I thought I could just like hop on a bed and take off, eh? Yeah, I'm 53 years old, but I feel like I'm almost 70. Yeah, it could almost make me cry sometime, but I just end up cursing and yelling away at myself.
But it's not just the physical recovery. Some ICU patients report having mental health challenges too, because you're not the same person coming out as you were going in.
Sit. Good girl. Down.
It was well before COVID. 10 years ago, Nadine Foster's liver failed, sending her to the ICU.
I have 6 weeks of memory loss.
Her physical recovery took years, but what surprised her was the anxiety and depression, the PTSD for her and her young family.
Their mom almost dying and being in hospital, that's quite a response. And then, marriages suffer too. So my husband and I are no longer together.
And she worries patients and healthcare providers still don't realize how significant the mental health challenges will be.
And a lot of people are too scared to go back and ask for help too, because their ICU experience was terrifying, right? So yeah, just don't be surprised. The things that you will go through will shock you.
Research of Ontario patients found a 22% higher risk of suicide and 15% higher risk of self-harm among ICU survivors than other patients admitted to the hospital. The risks are highest for people between 18 and 34 and for those with a pre-existing mental illness.
We have to be prepared for when all of those things add up, that it could certainly lead to an increase in suicide and self-harm.
Researcher and ICU doctor Shannon Fernando says the already overburdened healthcare system doesn't have the resources to help those patients.
If you're asking, does the infrastructure exist to take care of a huge burden of patients who are going to be suffering from significant psychological sequelae as a result of their critical illness? I think any of us who practice within this healthcare system can tell you the answer is probably no.
Anthony George hopes these hands will be able to create art again soon. The road back to his life as an artist will be faced with challenges he never imagined. Karen Pauls, CBC News, Sarnia.
Let's take a closer look now at the long-term challenges after ICU. Dr. Margaret Herridge is the co-lead of CanCove, a national research study focused primarily on the outcomes of long COVID patients. And Dr. Herridge, we often in the media talk about patients in ICU, but don't talk a lot about the consequences. And I suppose the longer a patient spends there, the more onerous or dire those consequences may be.
Yes, that's very much the case, Ian, and we know from the pre-COVID ICU literature that even after a week in the ICU, the majority of patients are unable to walk, and with each passing week in the ICU, patients have more disability, and with each passing week actually have an increase in one-year mortality. So it's very consequential to be in the ICU for a long period of time.
There are the physical consequences and mental health consequences as well.
Without a doubt, one of the major consequences physically is functional disability related to nerve and muscle injury. and there are a whole host of many other consequences as well. I think it's not perhaps known by the general public how important the mental health issues are: anxiety, depressive symptoms, PTSD. Many patients and their families may have suicidal ideation. Children are affected. It's a very traumatic life event.
There have been a lot of Canadians who have spent time in ICU with COVID and have survived. Are we ready in this country for those numbers?
I don't think so. We have always known about many of the consequences of critical illness for patients, families, children, but we have a huge number of post-COVID-19 ICU survivors and family members, and the sheer numbers create a very important public health and political issue, and we're really going to need to address this going forward.
All right. Dr. Herridge, thank you very much.
Thank you.